the latest on the coronavirus and vaccine news. Health authorities in New South Wales are investigating the death of a man days after receiving his coronavirus vaccine.
Now, meanwhile, Victoria has identified the site for a possible quarantine camp, and Queensland could soon be producing vaccines using the same technology as Pfizer and Moderna. So there is plenty happening. Now, reporter Ruby Cornish is joining us now from Sydney. We've got Zalika Rismail in Melbourne and Michael Rennie joins us from Brisbane. Ruby, let's go to you first. What do we know about this man's death?
Yeah, g'day Ben. So reportedly a 55-year-old man has died at Tamworth Hospital 8 days after he received a dose of the AstraZeneca vaccine. Now, details are really thin on the ground at this stage. The TGA says it's not yet known what the cause of death was or whether the death was in fact related to the vaccination at all. Now, as is protocol, whenever there's a death after a vaccination, there will be a thorough review conducted by the TGA into the death, and it will look at things like whether this man had a pre-existing condition, any medications he was on, things like that. Hopefully the review will help to answer lots of the questions that we have so that we'll find out more about this case before long.
Now, what's the delay that's been flagged for people who are over 50 and their vaccinations?
Yeah, this is something that has been announced by the Premier, Gladys Berejiklian. We do now have an opening date for our mass vaccination hub, which is where I am this morning, out at Homebush, about 20 minutes west of the CBD. It will open from the 10th of May, and when it does, it will be administering about half of the state's vaccines, so 60,000 doses a week. Now, people who will be able to book appointments at first are people who are eligible under phase 1 of the vaccine rollout. So that is frontline, quarantine and healthcare workers and their families. But as you say, notably missing from that list is over 50s. National Cabinet met last week and they agreed to let over 50s start to be vaccinated at mass hubs from the 3rd of May. But New South Wales has actually gone against that and decided to make them wait an extra 3 weeks. And so over 50s will now be able to get vaccinated at hubs from the 24th of May. Now, the Premier Gladys Berejiklian's reasoning for this is just logistical. She says that here in New South Wales we have 2.9 million people over the age of 50, and if we had them all trying to book appointments at the same time, the systems would be overwhelmed and it would be quite chaotic, so we should let people under phase 1 go first. Now, the good news for over 50s is that there is another way, because GPs will be able to administer vaccines, the AstraZeneca vaccine, from the 17th of May. So if you are over 50 and you don't want to wait until the 24th to book in your appointment, you can get to a GP from the 17th. And the Premier has said that really GPs should be the first port of call for over 50s.
All right, thank you. Ruby Cornish in Sydney. Let's go to Zalika Rismail in Melbourne. Zali, good morning to you. Now, late this afternoon, the ABC News in Melbourne broke this story about a potential quarantine hub. What more do we know this morning?
Good morning, Ben. Well, you might remember way back in February, the Victorian government announced its intention to construct a purpose-built quarantine facility away from the city as an alternative to hotel quarantine. Now, at that time, the front runner really was a site at Avalon Airport, but we do know today that the government is expected to announce a site in Mickleham, about 40 minutes north of Melbourne and about 20 minutes north of the airport on the Hume Highway there. Now, the site, we believe, is at or next to an existing federal pet and plant quarantine facility. Now, we still don't have any details about how big this site may be, how long it will take to construct, but we do know that the state government wants to build single-storey accommodation that removes that risk of hotel ventilation spreading the COVID-19. Of course, we've seen that happen several times now across Australia, including in Melbourne way back in February when we had that Melbourne Airport Holiday Inn outbreak. Now, the government still hasn't confirmed or denied that this site has been chosen, but we are expecting them to make that announcement this morning.
Right, thank you. Zalika Rismail in Melbourne. Michael Rennie is in Brisbane. Michael, there's a bit happening all over the place, and the news in Queensland is this news about University of Queensland and potentially producing an mRNA vaccine. What can you tell us?
Yeah, that's right, Ben. And so basically this facility will be established via some funding from the Australian government, $2.2 million of match funding. And basically what they're going to be doing is creating the building blocks for vaccines like Pfizer and Moderna. So it's not actually creating those vaccines, it's creating the building blocks to potentially make vaccines similar to that. It can also be used for cancer therapies as well. We know that Professor Trent Munro is heading this up. He was pivotal in helping to create the UQ vaccine that had to be ditched because there was some false positives coming up for HIV. But no doubt they'll be using some of the research and some of the knowledge that they learnt from what they did in that research and implementing it here. And as I said, this can be used for cancer therapies as well, and creating those vaccines of the future, because the pandemic, it's not going anywhere. We see what's happening over in India at the moment. So we're going to have to come up with new vaccines and new ways to fight this virus down the track. So perhaps this is just a step towards that, and UQ heading up again. So it's good to see that that research they did earlier on potentially isn't going to waste.
Exactly. All right, thanks, Michael. Michael Rennie in Brisbane for us this morning.